Well, y'all, thank you for coming. This is, again, to keep you advised and keep the people advised of actions that we're taking concerning the virus. As you know, the numbers, we're testing many more people than before, and we'll continue doing that, continue increasing our numbers. And of course, the numbers of positive cases are increasing, as they are elsewhere in the country. When we entered into this in March, we asked the hospitals to postpone, didn't require, but I asked them to postpone elective surgeries to the extent that they could, and they cooperated enormously and reduced expanded the available beds dramatically to where I think at one time about half the beds were empty. And it developed that those beds were not necessary, and so they began having the elective surgeries again, but still as of today, they are able to reduce the number of, or increase the number of beds as necessary. So we think that as far as having beds for COVID, we are adequately prepared for that. One thing that we have been disappointed is the lack of compliance with the regulations, the recommendations, I should say, of the Department of Health and Environmental Control and the Centers for Disease Control concerning the wearing of masks and social distancing. The best way to control this virus is for people to have the knowledge about how it is spread and how dangerous it is, and we know it's very dangerous. And we know now that it spreads not just by the large droplets, but also by close proximity breathing. In choirs, we've had reports of choirs where most everyone in a particular choir would get sick when it turned out that one person started off with the virus. So we've learned a lot, and we also know that the young people, Dr. Birx recently said that her estimate was that in the recent testing, somewhere between 60 and 70% of the younger population from 35 and below had the virus. They had tested positive around the country. In South Carolina, I think our numbers were recently, for those 30 and under, it was about 40%. Well, what that means is a lot of people have the virus and have had the virus and didn't even know it. And it's the younger people who do not have the underlying disease, underlying weaknesses in the system that are able to go right through it with minimal signs or none at all. And of course, this is the older population of those with underlying conditions that are at grave risk, and I mean grave mortal danger. So it is still a time that we must be very, very careful, particularly with school starting in August, and all the young people from younger grades all the way on up will be together. The chance for spread there is very high, but again, the population most greatly at risk for being sick and needing to go to the hospital and mortality, of course, is the older population. So we need to know that, and everyone needs to govern themselves according to that threat. And one step, a very big step that we have taken is called the Palmetto Priority Seal. And that is where the South Carolina Restaurant and Lodging Association, DHEC, and Parks, Recreation, Tourism have collaborated on an idea that had earlier been mentioned by Mayor Knox White in Greenville. They called it the Greenville Pride. Well, this is the Palmetto Priority Seal that has the active participation of DHEC, PRT, and the Restaurant and Lodging Association to provide a decal to go on restaurants that have passed the test and willing to conform to the requirements set out in the process. And that is, the staff will be wearing masks, that there'll be sanitation of the tables, of everything that you've heard about the menus, and all the facilities will be sanitized after each customer, and those in various spacing. And if they do that, if they have to take some training, online training, if they do that, then they will receive this decal. And that means that they are participating and that they are fully compliant. Now, how do we determine that they are fully compliant? Well, that's where the public comes in. And if if they have this seal, or and you go in, a customer, and you go in and you see that these requirements are not being met, then you can go on the internet and you can bring that fact to the authority of the Restaurant and Lodging Association. And they will inquire and they will counsel. And the restaurant will have 3 chances of not making it. And after the 4th chance, then the decal and the recognition and the clearance is taken back. And as for, I would recommend people, once this program begins and once the decals are available, if you go into a restaurant and it doesn't have this decal, it doesn't have this seal, go somewhere else. That's what I'd do. That's what I'm going to do. And that's what I urge everyone to do. And this will be the free market at no cost to the customer, with no limitation on anyone's constitutional rights. This will be a program and an effort that will produce a desired result, and it will work. So that's what we're here for, to announce today, and more details will be provided. John Durst is the president and CEO of the South Carolina Restaurant and Lodging Association. Dwayne Parrish is the director of Department of Parks, Recreation, and Tourism. And Marshall Taylor is the acting director of the South Carolina Department of Health and Environmental Control. John Durst.
Good afternoon. Thank you, Governor, very much. And I want to begin by expressing appreciation for your disciplined, strong leadership. It is my great honor on behalf of the South Carolina Restaurant and Lodging Association to bring just some very brief remarks about the program which the governor just announced. We are truly living in a very different world than any of us could have imagined at the beginning of this year. During these unprecedented times, we've witnessed the incredible strength and commitment of our hospitality industry to recover. With the help of our partners at the federal, state, and local levels, we have developed guidelines which provide a roadmap to strategically maximize and hasten our recovery as an industry. These guidelines are largely industry-driven, and they reflect the incredible collaboration between the governor's office, DHEC, PRT, the Department of Employment and Workforce, DOR, SLED, and Accelerate SC, among others. On behalf of our partners, we are therefore extremely pleased and honored to participate in announcing this Palmetto Priority Initiative. As we continue to work together, we look forward to strengthening the results of our unified push for a clean, safe dining experience for both our restaurants and patrons all across our great state. And that's what the Palmetto Priority is all about. Working together, we will be a model for resilience across our country, which will know what it really means to be South Carolina strong. Thank you.
Thank you. Dwayne Parrish.
Thank you, Governor. Thank you, John. I'm Dwayne Parrish with South Carolina Department of Parks, Recreation, and Tourism. If you think about all the wonderful food offerings we have in this state, from boiled peanuts, shrimp and grits, pimento cheese, we're so blessed in our agricultural heritage. So much so that in the PRT, we've actually done tourism campaigns surrounding that. The South Carolina Barbecue Trail, our Satisfy Your Thirst Trail. We are blessed to have those, and our South Carolina chef ambassadors, they live this every day through the rich heritage of the food that they prepare and serve to both visitors and residents alike. At PRT, we're certainly proud to partner with the restaurant industry, and certainly we take it upon ourselves that it's a wonderful thing that they have decided to embrace high standards of cleanliness, health, and safety to make everyone feel comfortable for both visitors, residents alike. As the governor alluded to, asking for patrons' feedback for the restaurants. And I think the great operators will certainly take the opportunity to sign up for this. If they're a member of the Restaurant Association, great. If they're not a member of the Restaurant Association, that's okay too. There's no cost for them to sign up for this program. So we think it's a wonderful opportunity for restaurants to show just how seriously they take this and how proud they are to be part of South Carolina's food offerings. I want to thank our collaboration with the Governor's Office, DHEC, and the South Carolina Restaurant and Lodging Association. Thank you.
Marshall Taylor.
Thank you, Governor. Good afternoon. My name is Marshall Taylor, and I'm the acting director at DHAC. And what the governor said is true. The numbers continue to rise, and it's important that everybody wears one of these, especially with regard to our young people. Remember, you're not doing it for yourself, you're doing it for everybody else. So with regard to this effort, from the first presence of COVID-19 in our state, DHAC and the South Carolina Restaurant and Lodging Association have worked together to gather information and best practices to advise the governor and the Accelerate South Carolina on guidance for our state's retail food establishments. DHAC is proud to be a part of South Carolina Palmetto Priority, which is another great step our state is taking in continuing to protect health while we carefully reopen the state's restaurant community. The Palmetto Priority is a formal commitment that restaurant owners can take to show their dedication to adhering to the current recommended precautions for protecting their employees and patrons from COVID-19. DHAC will provide verification that a restaurant meets the criteria to participate in the program. By choosing to dine at a restaurant that has opted to participate in the Palmetto Priority Pledge, customers can rest assured that the restaurant has met the specific requirements established through the South Carolina Restaurant and Lodging Association's restaurant reopening guidance. The pandemic has made us all be creative and innovative in our ongoing commitment to protecting the health and well-being of South Carolinians, and we appreciate this opportunity to join our partners in protecting the state of South Carolina's health. Thank you.
Thank you, Marshall. Let me mention some of these requirements. The restaurant must complete a DHAC virtual food safety check or a limited scope food safety inspection, and that'll be available at different times. They must be available. They're available for free by scheduling it with the inspectors. They can confirm all of that on the website. The managers of the restaurants must complete the Serve Safe reopening guidance. And there's a 13-minute course available on servesafe.com. There'll be a certificate of completion. All employees of the restaurant must be trained on the appropriate cleaning and disinfecting, hand hygiene, proper face covering, and respiratory etiquette. And there's additional information as well. They must adhere to the minimum standards outlined by the South Carolina Restaurant and Lodging Association restaurant reopening guidance, and that includes a variety of things, most of which you've heard of before. They have signs about advising customers not to enter if they're symptomatic. Select one person per shift to be in charge of the safety and sanitation during the shift. Signs reminding of hand hygiene and proper hand washing for customers and staff. Each employee is required to wear a face covering, that is a cloth or paper face covering, face mask, or full face shield. Hand sanitizing stations have to be available for all customers and employees. Those are the kind of things, and that's only about a half of the list. And those are the kind of things that they must all agree to implement and to continue going in order to receive this. And as I mentioned, the fourth time that it's verified that they're not following those procedures and guidelines, and they lose their sticker. And again, this is a great way. It's probably the most effective way to get this done here. Are there any questions? Shauna?
So restaurants have been open or allowed to be open for 6 weeks now. Expand on the timing of this. Why now?
Well, this was an idea that came up during Accelerate SC. And as I mentioned, they have done it in Greenville. It's a little bit different. But this has been worked on for some period of time, and we believe that it'll work. At the beginning, the restaurants were more limited. First, as you recall, it was outdoor service only, pickup service, and then later it was outdoor service, and then it was a certain percentage of indoor service, and now it's limited indoor service with pursuant to the various guidelines. This is a way to guarantee, to certify to the public that that particular restaurant is doing all the things that the science today says they should do for best practices to be sure that that virus is not spread in that restaurant.
When's the soonest that they can actually get that decal?
When's the soonest they can get the decal?
Website is up.
The website is up now. What's the website?
It's on the.
Sure. Yeah, it's PalmettoPride.com is the website. It's available on there now. There's an application for restaurants to sign up right away.
How long does it take them to get it?
To
To
get
get
it
the
back,
sticker?
Governor, if I may, the test that, I'm sorry, sir. The test that people who are interested in receiving the certification will be taking, it takes about 30 seconds to 60 seconds to go through the initial phase. There are several phases they can go through, but after they satisfactorily complete that initial questionnaire, they can push a button and then they receive their certificate and they're good to go. So we're ready to hit the ground running. Thank you, sir.
Yes, sir.
Restaurant Week, is that going to come back this year?
Say it again.
South Carolina Restaurant Week, will we be able to celebrate that this year? Or not?
We have every expectation and plan to do so. Thank you for asking.
Thanks, sir.
And when is it?
Yes, it's in October, so we got a ways to go. Yes.
Yes, sir.
Governor, if an employee at a business tests positive, does that jeopardize their ability to participate in this program?
That will be handled in a slightly different way. There are protocols in effect to what to do when that happens, and the restaurants would be required, of course, to follow those protocols. Yes, sir.
So if a restaurant loses their seal, what's the next step? Are they still open for business, or what happens?
They're still open for business, but they don't have the seal. Now, they could reapply. They could confess error and agree to do it right the next time, and provided they did, they'd be able to receive another seal. But again, this if a customer goes in and they see that seal and they go in, and I would advise people, don't go in if you don't see that seal. But when they go in, the customer is being assured by that restaurant, by that management, that restaurant is following these rules. If they are not following those rules, then I would urge those same customers to go to the website and provide that information to the restaurant association. The restaurant association will then follow up on that, and if it is not fixed, if it is determined to be accurate in the first place, and if it is found to be accurate, then they must fix it. It must be satisfied that it has been fixed. But then they get 2 more strikes, and after that, actually the 4th strike, they're out. They lose their seal.
Is that
Yes, sir.
follow-up then to
Yeah.
make sure that this is there is no surprise inspection by the restaurant association?
No.
You have to make sure
No.
they're following the rules.
No. This is even better than that, because every time a customer walks in, that's an inspection, walking in the door, every time.
The limited scope DHEC inspection, what is a limited scope inspection?
So we conduct a virtual inspection, which is a checklist that we walk through online with the restaurant owner, and basically provide recommendations and guidance. We've been conducting virtual food inspections previously, and this will actually, there will be additional guidance related to, wearing of mask and to follow the guidelines that are being set forth.
How quickly can you verify the restaurants apply for this seal that they're actually doing the steps they need to? Because from what it sounds like, they can get this seal pretty quickly, but how can you verify that they're actually doing what they say they're doing?
Right, so we'll be going through that verification process immediately, now that this has been actually put out there. And we'll be conducting we've been conducting these virtual inspections, and then after July 1st is when we'll be conducting these additional verifications with these restaurants.
If a restaurant continues to be a problem, could there be further action besides losing the seal?
Sure, DHEC has the authority if under a different set of rules to take necessary action if someone is endangering the public health.
As you know, Columbia City Council will, in a few hours, probably vote to require masks everywhere in city limits. What do you think of that ordinance? Greenville has another ordinance. Can they do that? Would this trump that by any means?
Well, this is different from that. This applies to restaurants, and it is not a mandatory thing. There's no criminal penalty. There's no penalty other than the loss of customers when you found to not be have a compliant restaurant. But with mandatory orders, there are difficulties of enforcement, and there are also questions of constitutional limits. One way that we are sure that we are not violating any constitutional limit is to use this approach, and that is one reason that this is a very good approach.
But what do you think of theirs?
Well, they'll have to answer those questions if they're raised. It depends on the extent to which whatever the ordinances are limit the personal liberty. And those are questions. For example, if Typhoid Mary were to walk into town, or someone is obviously very, very ill, if someone has tuberculosis, DHEC can take measures to quarantine that person even against their will. That's the extreme case. With this virus, you have people out there who may be ill, that are certainly are not ill. You have people who were ill and are not ill anymore. So the more you have a blanket ordinance restricting liberty beyond what is clearly a case of a contagious illness, that's where there's difficulty in drawing the line. That's why an approach like this one is a very good approach, because there's no question about this. Yes, ma'am.
Continue to rise, and people don't social distance. Where are the masks? Do you foresee you maybe asking lawmakers for a mask law, or to make that law more?
Well, no, we are not to that point. That could happen in the future, but that's not. We don't foresee that. We believe that these measures will work. Yes, sir.
Do you wish you might have worn a mask more in April and May and emphasized it more, so maybe people would get over this kind of personal aversion that a lot of people have about wearing masks?
Well, the only places I went were as I explained one time to folks, was to the Emergency Management Division, and then back to the house. That's about the only places I go now. But I take a mask with me, and on the very limited occasions when I'm out, I'll wear a mask.
Well, the emphasis on masks didn't start until maybe June or so, maybe a little bit in May. I mean, there was talk about it, but the real big emphasis, do you think the state might have missed an opportunity to nip this increase in the bud by maybe?
No, sir, because the use of a mask, the effectiveness of the various masks, which of course differ, was a subject that was brought up, I believe, in every single conference that we had, every one, from the very beginning.
Sorry to interrupt there.
That's all right.
You just mentioned that you would consider perhaps a mask ordinance if numbers got out of control.
No, I'm saying nothing is, we'll make those decisions as they become necessary to make.
Consider it. I'm saying what numbers specifically are you looking at?
You can't put a number on it, because it depends on a lot of variable factors, including the fact that a lot of the people that we're testing more, so we're getting bigger numbers, and we believe that we know who the population, the segments of the population that are more susceptible and are not even showing any symptoms at all. So it's a moving target. But we will do everything that is necessary to see to it, to the extent that we have the capacity to see that people are safe. The main thing is by providing information, as we're doing today. Yes, sir.
Sir, can you elaborate on people making complaints about a restaurant? How do we verify that these are legitimate complaints and that it's not done to harass?
Well, one part of that is Of course, some people make complaints that are, maybe it's a very small item and maybe it's a mistake, maybe it's an error, an observation, and those sorts of things will be confirmed by the Restaurant Association in their investigation. But someone who's maliciously spreading misinformation about a restaurant would, of course, be subject to the standard laws on libel and slander. Would you like to answer that?
Well, Governor, I think you covered it extremely well. One of our staff persons will follow up on each complaint that is brought to our attention, and by that we mean they will get with the restaurant to discuss with them the substance of the point that was raised. And if, as the governor indicated, there begins to develop a pattern with respect to an individual, then that'll certainly come out. But it's important to stress that this is a one-on-one conversation that we will be having with the restaurateur to be sure that they are aware that this has come to our attention and to work with them on resolving the issue.
We've got a lot of restaurants in this state. How many people do we have dedicated to actually doing those follow-ups?
Well, right now, we're in the process of getting some additional folks that are going to assist with that. We do have a small staff, but we haven't tried to put a number on that, and we're hoping that it's not going to be required that we do have to have a large number of people following up.
Governor, July 4th is coming up. There's been reports of certain cases. PGA golfers said Hilton Head would like to do. Are you worried that negative attention?
I'm sorry, who said what?
There was a golfer that said that Hilton Head was the zoo during the recent golf tournament in Hilton Head. Are you worried that the negative attention of rising cases are just going to negatively affect how much negatively hurts our tourism industry without taking additional precautions?
Without doing what?
Without taking other precautions?
Well, we are taking precautions. And South Carolina, as you heard Dwayne Parrish mention just a few of the assets, the attractions in South Carolina. They're from the mountains to the oceans and everywhere in between. South Carolina is a great tourist state, and we want to keep it that way. We are, if people will follow the advice that we are given in DHEC and the Centers for Disease Control and others, and particularly with efforts like this, campaigns like this one, I'm confident that we will do well.
In that same vein, are you surprised then with all the guidance that you guys have issued to the public that you're seeing a spike in percent positives in the state?
I'm not surprised about the spike, because the spike is happening around the country, and it's to be partly expected when you're testing many more people than we are. But am I concerned about the fact that people seem to not be social distancing, not wearing masks when they ought to be wearing masks? Yes, I am concerned about that. And that's why we keep saying, people, please follow the advice. And everybody knows what that is, but please do it. It's important, because this is a deadly disease, and we know now it's spread very quickly, very easily.
Two more questions.
Mr. Governor, is not pursuing the mask mandate, is that because it's an unconstitutional thing, or is it because of enforcement?
There are limits. There are constitutional limits, and it's not quite sure where those are. But there certainly is an enforcement question involved in it. But the main answer is this is a better vehicle to accomplish the same goal, and this has no cost. It ties up no police resources. It is a very positive thing, and we believe that it'll work very well.
Governor,
Yes, Sean?
just a logistical thing. Obviously, people need to be able to see that as they come in. How big is that sticker?
Dwayne, what are the dimensions?
Diameter 8 inches.
8 inches in diameter.
Can I,
Diameter is from one side to the other.
may I?
Through the middle.
I just wanted to go back to one thing that the governor mentioned totally correctly, and that is with respect to face masks. And they may be, and this is from DHEC and the CDC, cloth or paper face coverings, face masks, or full face shields That third category is particularly designed for folks who are working in the kitchen, because the heat back there is much greater and it is much more practical for them to have the full face shields. So thank you, I just wanted to pinpoint that.
Thank you, everyone.
Thank you.